Hi everyone, welcome to Mind Matters, a space where we delve into the complexities of the human mind. Mind Matters is an initiative taken by SEREKO where we talk to experts to make mental health more accessible to everybody. Today we have Kirats with us. She is a practicing psychologist at the Mind Garden. And thank you, Kirats, for being with us here today. And let's hear it from her. She has a very interesting journey of herself. So let's hear it from the horse's mouth.
I ended up in this field of psychology through a very interesting journey of my own. I have myself struggled with depression, and luckily I had a great partner who could recognize that I was going through something, and so I took therapy. I got better, and that's when I decided to change my career, because I was like, if I started this career with the fact that I want to help one person. That was my goal. I was like, if I can change one person's life for the better, like how mine was changed by my therapist, I think I've done enough good karma to last me multiple lifetimes. So, that's how I started this. And that's why the whole issue of mental health and therapies and good ethical practices is very, very close to my heart, and I take this very, very seriously, and I'm very happy to be here to discuss this further with you.
Thank you so much, Kirat. I think this is very inspiring to know that where you come from, this is to genuinely kind of help people because you've experienced it firsthand.
Right.
So I think let's just quickly delve into the podcast and Okay, so the agenda for today would be talking about mental health, especially in women. We do realize that mental health in women is worse as compared to men. I mean, women suffer from mental health 3x more as compared to men. When we have problems like a cold or a cough, we don't immediately go for a diagnosis we don't immediately get a blood test done for typhoid or malaria.
Right.
We first visit a physician. Mm-hmm. So why is the same not for mental health? I mean, why do we keep struggling with it internally, and why do we not recognize it, or why we're not upfront about it that if we're suffering through stress or any kind of a breakdown, why is there hesitation to kind of go to an expert? So the agenda is to normalize seeking help for mental health from an expert. So let's just kind of delve into the podcast now. And my first question to you is, why do women hesitate to come forward with mental health issues that they're struggling with? Do you think the society dismissing psychological symptoms like mood swings as tantrums has anything to do with it?
Right. So actually, women and psychological problems have a very interesting history. So there's this word called hysteria, right? Which was coined in I think 500 BC in Greek by Plato and the others, I think. And it was and hysteria is taken from the Greek word that means uterus.
Okay.
So even in the Victorian times, it would be like, oh, this is a hysterical problem. And hysteria was associated with women, and it was associated with the fact that, oh, the uterus moves in your body. Okay, and when it moves, these issues are caused. So, and how can it be solved? Please have a child or have more sexual intercourse. That is how. And only way you could have sexual intercourse would be to get married. So it was basically because they would see women with this very narrow lens of that you're just a reproductive being, and that's what you're supposed to do. So if you're not doing those things, then if you're writing, if you're thinking, if you have heart palpitations, you're sweating too much, oh, it's hysteria. So It was a wide umbrella term which used every issue with a woman that a man could not understand. So this I'm talking about 500 BC, right? It's carried on throughout, and it was only in I think the 1980s when the word hysteria was taken out from the DSM, like the Diagnostic Statistical Manual, which has all the disorders in it and the explanations for them. So we carried it on till 1980s. So the number of years that women have carried this tag, it's going to take a lot longer to uncarry it, right? It is in our DNAs, it's in our society. It's in how we behave, how we women view each other, how men view women. So it's just, I mean, it's easy to tag it as a tantrum, right? Because when there is no research on women, when there's such a big male bias in medicine itself, where research on, say, a heart attack will be conducted on 8,000 men, not a single woman. That is the state where we are at. And even common ailments, not common I would say, but it's something that is very prevalent, like things like endometriosis or PCOS or even breast cancer. For the longest time, it was that, oh, because you're not having children, that's why you have this. You go to a gynaec, even now women face this. When you go to a gynaec who have endometriosis, they'll be like, so that is the stage we're at. And to imagine, to fight that, whatever problem that you might have, exaggerate kar rahe hai,
absolutely correct. So, I mean, we very commonly hear that, oh, she must be PMSing, oh, she must be just, she's having mood swings, she's just, I mean, hysteria. Even today, we comment this, we hear these comments where, people say that, oh, she just went hysterical over that incident.
Right.
So it's, oh, she's just hormonal.
Yeah.
Oh, she has too many tantrums, she's just seeking attention. We hear these kind of comments too often.
That's true. And then women carry it, and then we ask them, why don't they seek help?
Right.
Because when they seek help, they get this. And mental health anyways has such a stigma attached to it.
Correct.
So these instances that I'm talking about are not even as a psychologist that I see.
Yeah.
These are incidents that I hear of my patients who went to a gynecologist or who went to a general physician and then had to hear this, that, oh, your pain is dismissed.
Right.
Because मर्द को दर्द नहीं होता और औरत को सहना चाहिए. So concept ही खत्म हो गया है ना. So मतलब it's so easy. So, I mean, it's just
very relevant.
The state of it, so you can't do much.
Of course, no, I think that is very, very relevant. That hesitation has been it carries on from the ancient time. Like you mentioned, the history about hysteria, it's very relevant because women are, I think, under the pressure to not cause a scene, to not make a scene.
Yeah.
And that's why they kind of don't come forward with what they're actually feeling inside.
Right.
So, no, that is very relevant. And how do you think then we can acknowledge mood swings as a legitimate symptom of mental health concern and, kind of not just dismiss it as an emotional overreaction?
Right. I mean, tantrums, I think men have tantrums as well.
Right.
You see these jokes where a woman is like, oh, I have 2 children, 2 actual children, and one husband, like, वो भी मेरा बच्चा ही है. Because the man's tantrums are okay, but a woman's tantrums are tantrums.
Right.
So we, is to try and see it as trying to find the root cause or trying to understand the situation or the problem. These days we're very quick to just pass judgment and be like, oh, this is the reason or that is the reason, when we actually don't know what the reason is.
Of course.
There's also a thing that you must be crazy to do this.
Right.
I think we are all crazy, and very rightly so. Like, I feel I'm pretty crazy. I've changed multiple careers, and I tend to do things on the whim. But does that mean that every time I have a place where I go low, or I'm sad about something, or I'm angry about something, or something's not working out, I'm a human being, I'm allowed to have those feelings.
Right.
So when I express that anger, please take it as anger. Don't attach the word tantrum to it.
Correct.
A tantrum is, we all know what a tantrum is. Like, you see a toddler in, we've seen those videos where in the grocery aisle, the toddler is banging it. That's a tantrum. I have never seen a woman do that.
Yeah.
Very honest. Like, on the street, she's banging her head into things, or screaming, shouting randomly without any cause, or this thing. That could be a tantrum. So I think just the language that we use, we should keep a check on that.
Absolutely. And I think what you're saying, also follows from exactly that the women have a fear of being judged. As children, as a society, we've always been told that women are supposed to be timid, they're supposed to be delicate, keep your legs crossed, don't sit wide-legged.
Yeah.
And, and the characteristics of bold, anger, and putting their foot down, they're all characteristics associated with men typically.
Yeah.
If women do it, then it seems to be like something's wrong. strong.
She's bossy.
Yeah, she's bossy.
Yeah.
She's
not a boss. She's bossy. You know.
Yes,
like, it's,
exactly.
It's such a terrible term to use.
Of course.
She can't be authoritative. And
if a woman puts her foot down, then there is something wrong. It's unordinary.
Right. और तो कुछ हो ही नहीं सकता, you know. So God forbid I have an emotion that is not associated with my hormones.
Exactly. I mean, this is very commonly, it's become a joke now.
Yeah.
I mean, as a narrative, I think, as a narrative for periods has also progressed, where we talk about being down and periods very openly in workspaces and in front of our colleagues and all. It's also become that it's also been started taken this for granted, where we hear these comments like, oh, she must be PMSing.
Yeah.
Oh, are you on your cycle?
Right.
So this is, it's not okay.
Yeah, I was on a motorcycle and run you over. That's what I feel like people telling me, are you on your cycle?
Right.
That would make more sense.
No, that is absolutely correct. So what do you think is the most pressing disorder that women usually come to you with, and why do you think that's prevalent amongst women specifically?
So to be very honest, there is no such specification or diversification that women come with this more or not. They're pretty equal both ways. It's just that it's harder for women to just come in the first place to seek help, right? There is I in my personal practice haven't seen a big differentiation. Men, women, they all have anxiety, depression, low moods. Like, it comes together. There is no such differentiation. Obviously, the cultural impact as well on men and women, that comes differently for women, because it's such a suffocating environment for so many of them. Be it the most educated families, be the most wealthiest families, the pressures on the woman are still the same.
Right.
So I think that the place where they come from is different. Not the disorder in itself, or not the problem. I won't even call it a disorder. Like anxiety, everybody has it. But for women, that's where it differentiates. That you're feeling so suffocated. How do you get out of it? Like, that's where they come from. Or they're that this is the structure that my grandmother followed, my mother followed. I am uncomfortable following it.
Right.
How do I carry on this legacy yet be myself and be accepted? The acceptance part is what women, I think, usually face.
Of course, but what I'm trying to actually kind of get at is, this is for our viewers, that what kind of disorder, I would not call it disorders myself, concerns.
Yeah.
So what kind of, out of the women patients that you do kind of treat, so out of them, which concerns are the most prevalent? For if I was to say for skin, it's acne and pigmentation that women are struggling with the most.
Right.
So from a mental health point of view, what concerns are so that the women are struggling with the most, perhaps?
See, usually it's, women, we are always categorized into the nurturer.
Correct.
So you're so used to caring for everybody else that you've forgotten how to care for yourself. And when you forget to fill your own cup, you cannot water everybody else. So that is what you see immediately in many, especially millennial and above. Like, I think Gen Z is superb. Kudos to them. They don't give a shit. But millennials and above, like, it's always that I'm not able to do for XYZ.
Okay.
And then to bring them back to what do you need?
So do they come to you, do they know that they have this issue, or they just come to you with I would say, not like a problem statement or a specific problem? Do they recognize that they have anxiety or they have depression, in so many words if we were to put it? Or they just come to you whether I'm not happy, or I think I'm not able to provide, like you're saying?
Yeah.
So is that the case more?
They come out of discomfort.
Right,
Sometimes you don't know what is this discomfort. Or that I don't feel like me.
Okay.
That's
so similar to if I have a stomachache, then I don't know the cause of the stomachache. Could be acidity, it could be gas, it could be something else, it could be a stomach infection.
That's true.
So similarly, they would just give you a symptom, but they don't know what the cause is.
Yeah, or they would think that it's this XYZ. It's my children. I'm very worried about my children. but actually it's been
Okay.
it's coming from somewhere totally different. But this is where it's presenting itself.
Right.
You know, so like, I mean, you can be like, oh, I have a stomach ache, but it's actually that your appendix is what is needed, like,
Correct,
that needs to be
correct,
taken out, but
correct.
you don't know where it is
Where
and
it is,
how,
right.
like, how it works, and we're not all into biology and anatomy, so we're not able to understand that aspect. So it usually, I mean, for all of us, like even for me, like when I've been in a bad place, it's been that, oh, you know, this aspect is not working. Little do I know that it's, you know, the workbook that I've grown up with. I mean, we're born, no one gives us a handbook, you know, ki zindagi aise jeena.
Right.
No one tells you. So how do you learn? You observe. You see people around you. You see your parents. You see your grandparents, your friends, other influences, you know, and that's how we pick and learn. And sometimes we pick these things up, and they serve us from point A to B. But then it is not serving us anymore after point B, and then we're stuck. We're like, you know, like, I don't know what is happening. Like,
Yeah.
it was working all fine. You know, I mean, I don't know if you've seen like Deepika Padukone's interviews. You know, like she's one of the biggest influences that has come out
Of course,
in this
of course.
space. So, I mean, you would see and be like, yeah, this is the problem. I wish I had her life.
Correct.
You know, I don't know how many times you've said that.
Yeah.
Most beautiful, everything, all of that, but we don't know what the issue is and where it's coming from. So similarly with, I think, all women or even all patients, I wouldn't categorize it specifically to women, but mostly for everybody, that's where it comes from. But the burden women carry.
Of course.
Yeah.
No, I think it's very relevant that it so happens, like we were just discussing, that you don't even know what you don't even know. You know, they don't know what is actually troubling them, because yes, we're born with like a manual which exhausts itself.
Exactly.
So we don't know what next, like what is the next chapter going to be. We have to write it ourselves, and that's where we get stuck, and we don't even know that this is a problem which can be solved through professional help.
Yeah,
There
because
are so
you have
many...
to be crazy to seek professional help.
Absolutely, exactly. You have to be crazy to seek professional help, because it's not ordinary. We don't talk about it in the ordinary parlance. So, and also because it's an intangible feeling, you know, it doesn't manifest itself like a stomachache or a headache, which is constantly kind of hammering you at that moment. So this feeling of discomfort or stress, it usually comes, I mean, I'm just kind of assuming it comes in episodes.
It does.
It's not a constant feeling of stress that makes you so uncomfortable at a particular point that you feel, okay, I need to see a doctor for this.
Right.
So because it's not measurable, so to say, so I mean, for a fever, we have a thermometer to measure. But for our stress or for our anxiety, for our depression, how sad we are, how can we measure how sad we are? And what is the right time to seek help? So what do you think are some early signs that someone might be struggling with their mental health should seek out when they seek professional help?
So, you know, this is a very tricky question. Like you said, it comes in episodes. But when they are not episodes anymore, it's just a non-stop show. That's when when you fully know. And it's usually what I have seen is that somebody near and dear to you will be like, you know, you've been doing this, and we want to immediately protect her, and like, you know, like, I'm fine, or I'm just going through this, or today was a bad day. We'll give excuses, and then, I mean, unfortunately, no one wants to address the early signs. Because early signs could just be a bad day as well, right?
Right.
It could be a bad week. It could be a bad month. But when it's 6 bad months and you're not able to get out of it, I think you should definitely. And also, advice comes from all kinds of people, right? I think I would suggest that pick your people. You know who your well-wishers are. And when they tell you that, you know, like, I feel like you're not yourself, or, you know, you've been going, also, be a good friend. I think that's my other thing. Not just to seek help, make sure that, you know, you point out.
Yes, of course.
You know, I think I've had that experience where I had my husband be like, you know, I mean, we weren't even married then, but he was like, I don't think this is you. I've known you for like 6-7 years, but you're going through something. And, you know, in my practice, I've had people come who've got their spouses, who called for their friends and be like, you know, I'm seeking help for my friend. I'm just making sure, you know, what do you provide? So be that good friend.
Right.
You know, that makes a big difference.
And I think that will be the starting point to destigmatize this.
Yeah.
When, I mean, if you're not doing it for yourself, do it for somebody, kind of normalize this so that they know that people around them feel it's normal for them to go to therapy.
Yeah. So, you know, even that's also a tricky space again.
Right.
You, somebody is telling you that, oh, you need to go for therapy, and you're like, why are you attacking me? Like, you know, like, I'm fine, I'm okay. And then you try to, like, because, I mean, you want to, I'll work through it, मैं yoga कर लूँगी, मैं meditation कर लूँगी, you know, things like that. Like, I'll bandage it up.
Correct.
You know, because vulnerability is very hard. So until unless you as a friend say that, you know, like, I'm also going through a hard time.
Yeah.
Then the other person will be like, yeah, I'm
open up. Correct.
You're like, I'm fine, you need help. And you'll be like, excuse me? You need help. You know, so that sort of situation happens. So to be a good friend also, it's very hard.
Of course.
But, I mean, I think read up on it. I always suggest, like, to people to be like, research for your friend, partner, whoever, parent, you know, do a few rounds, call up, then you have to, it's a tricky situation.
Of course. Yeah, no, that's very true. I think the next segment is going to be our, I think that's something that is very, very relevant and prevalent today. So, which is postpartum depression.
Right.
20% of women go through postpartum depression. And I mean, it's very often, I've seen this personally with my friends and family, where women, before they get pregnant, they tell their husbands, and listen, my body's going to change. I'm not going to look the same. Will you love me the same? So, you know, this kind of insecurity kind of boils up from the time that they're pregnant.
Right.
And then they have, after they deliver the baby, they have mom guilt. That, oh, do I not love my child? That I'm depressed. I'm not happy about the birth of my child. So, we hear, of course, then there are all types of other people in the society that make it worse for you. That add fuel to, of course, that add fuel to fire. And they're like, oh, why are you so sad? You just had a baby. You should be happy. You're glowing. Why are you not feeling good? So what is postpartum depression? How normal is it? And how should women approach it?
Yeah. I mean, you know, you said the number of 20%. I wonder if it's 24% that's reported. You know, the amount that would go unreported would be a whole nother scene, right?
True.
So, I mean, again, and I've seen it in hospitals where the psychologist comes. I've had clients this has happened to them, where the lady has given birth 20 hours before. She's in the room, her mother-in-law is in the room, her random friend is in the room, so whatever, they've come to meet her.
Yeah.
The psychologist has come and she's like, "Aap theek ho? You're feeling fine? I mean, आपको कोई problem तो नहीं है?" Checklist है उसके पास, you know? She's ticking her questions because, I mean, that's her job. She's done. She's like, there is no confidentiality. I mean, look at where you are. You're in India. Your mother-in-law is sitting here. Please first ask her to leave. You know, वो वहाँ पे उसके पोते whatever के बारे में आप वो ना बोलेंगे कि नहीं मतलब I feel devastated right now. Also, it's not going to hit her right now. You know, it's going to hit her in a week or two when she's gone back home and no one gives a crap about her anymore.
Right.
You know, no one's coming and asking, oh, how are you? No, they're like, बच्चा कैसा है? बच्चे ने खा लिया, बच्चे ने potty कर ली, बच्चे का सफाई कर दिया, उसने नहा लिया, उसकी मालिश कर दी. आपका क्या हो रहा है? कोई बात नहीं, आप ठीक हो. You'll be fine. So that is what happens. And then you start feeling like, do I not mean anymore? Like, am I just, you know,
a baby delivery system?
And a cow is what, you know, a lot of clients have mentioned. And the other thing is that it's the body identity, you know, we know that the brain shrinks because the whole body is working towards, you know, helping the child out.
So the brain shrinks during that period.
Yeah, and it takes time to go back, you know.
Okay.
Yeah, and along with all your organs which have like moved aside to make space for the child. And even I'm very, very, very rarely, I don't think, I'm trying to recall if I've ever met a new mother who has been like, oh, I'm smitten by my child. Nobody. First of all, your child looks like a raisin. Okay, so you're like, this has come out of me, like, you know, and you are not connected. because you're just reeling with what you've gone through. Like,
Right.
so you know,
There's so much physical and mental trauma that you've been subjected to during that process. Of
so
course.
it's very hard for them to now suddenly they're just happy that the child is out of them. That is what they're happy about.
They're relieved.
Yeah.
The relief is what they feel the most that time.
Yeah.
Correct.
You know, they're relieved
That they're alive.
Exactly.
Because I mean, this happened very close to someone very close to me, where they were asking questions like, "Am I going to die?
Yeah.
Am I going to die giving birth? What if I die?" And they were like, and the doctors had to tell her that no, this is normal. It happens to everybody.
Yeah.
But they are genuine concern. That's genuine. That's a genuine fear.
Yeah, because we don't educate firstly a woman
Of
before she's having a child, that you know that this is what you can go through. First of all, even the child.
Yeah.
I mean, I have an issue with the whole childbearing process where because one English king wanted to see the birth of his child, that's why we deliver on our back. You know, that is not the normal human way to deliver. You have to deliver on all fours.
Right.
So, I mean, if I go back to history, it dates back that this is why, so that the doctor can see, the man, the king could see how his child. That's why, otherwise, you know, like the normal, I say the animalistic way is on all fours.
Of course, exactly.
Yeah,
that's
so,
exactly what that instantly clicked my head was that's how animals deliver.
Yeah. So, I mean, whatever we might have like, our nails done, but it's still animals.
Of course, of course.
So that would be a natural way to do it. So even that, from the very inception of it, is twisted.
Right.
So I mean, then you expect that this woman should just be up and about.
Be up and about, absolutely.
Yeah, and even for men, you know, like I mean, they're not given any education on how to do. But I've seen some superb men who have you know, been right next to their woman, going through all the classes, the mass classes, and have actually helped during labor as well, because they have remembered and learned, you know, what was being taught, and they're like, "Nahi, aisa nahi, aise karna hai." Like, you know, we have the authority to be like, and that's what you need. You need that solid support.
Correct. So, is there any instance of a patient who came with such a problem of postpartum depression that you've dealt with, which you, of course, I mean, basis if you're given that you're comfortable sharing, and also, did they recognize that this was postpartum depression and it's a temporary kind of situation that they're in and it can be resolved, or they just didn't recognize it was an issue, or there is a genuine concern which exists, there's a problem, like there's a specific problem that is apportioned to this kind of issue that happens after delivery, post-delivery.
See, in I think nowadays, like in the most like in the educated sector, most women know about postpartum.
Correct.
Right? They're aware, or the doctors have mentioned it, or that this is something.
Okay, so doctors do sensitize women
that
now.
This is something that can happen. Like it's not like a.
But it's scary. I mean,
it's not a full construction that's given.
Right.
And it's dead in passing, and everybody obviously reading whatever A to Z baby.
Google.
Or whatever, you know, Google, and then the books, all of that. Surprisingly, all of that's from before you give birth, right? There's nothing after it.
Right.
And the problem is that you give birth and life goes on.
Yeah.
You know, nobody has stopped. You know, all problems, all issues, they're all still going on. And you've given birth, but now you're depleted, and you don't know when it's going to kick in.
Yeah.
Yeah. You can be aware of it. It can be somewhere in the back of your mind. But when emotions take over and you're crying, and you don't know why you're crying, and your husband is like, "Oh, you're being hysterical," you know.
Right.
So I mean, that's when you don't have that support from people around you. I don't think the onus is on the woman here.
So you have had any patients?
Yeah, I have had patients, and you know, like I said, I mean, the delivery or they gave birth when life was anyways so hard.
Yeah.
So you internalize everything, and you know, my patient was like rearing through I'm going to do this on my own, and I don't want to take any help. You know, this like this image that we have of you know, mother powerful, like, you know, she's going to do everything herself. And to really get her out of it, to be like, it's okay to take help. No one's giving you an award. No one gives any woman an award
for bearing a child.
For taking care of a child on her own. I said, if you take care by yourself, people look at me, pagal hai, help kyun nahi le rahi, hai na?
Right.
If you take help, arey, kaisi maa hai, help le rahi hai. You do,
Either way, you're going to be crushed.
So So you have to like really just own your own situation and be like, this is how much I can do. Learn, see the signs when you're, when you're actually breaking down. And
mom guilt, like especially for working women.
Yeah.
What do you think? I mean, because this is something that I have heard from so many of my working friends who have kids,
right,
where they say that I have a lot of mom guilt today because I was all day working and I just didn't meet her or meet my kid.
Right.
So then, what do you have to say about that?
Yeah. So see, with that, I say, if you are a happy mom, your child, however is being raised, will look and be like, yeah, my mom's happy.
Right.
They're gonna absorb that happiness.
Correct.
You're gonna be, and mom guilt is fine. It's okay. I don't like the word guilt in general because I associate guilt with crime. Like you're guilty when you've committed a crime.
Correct.
This is providing for your family, working is not a crime. It's okay to take care of yourself as well. So I try to dissociate the word guilt from them. I said, of course you're going to be attached to your kid. Of course you're going to feel bad. You and the kid both feel bad. And it's okay to feel bad. Acknowledge that. Come back home, hug your kid, tell them that, oh, I felt so bad leaving you, but I have to work, I have to do X, Y, thing. I'm going to make sure that, you become this great person. I'm going to support you in that. Mama needs your support as well. So you be honest in how you're feeling instead of being like, hi, I feel so bad, main kya karu, kuch nahi kar sakte, life hai. You have to keep living. If you stop living, you stop caring for yourself. And I mean, ghar pe baith ke, if you're continuously you're
obsessing over your child, and that is not healthy for them as well. And also I feel that you're absolutely right that the term guilt should be eliminated altogether from these kind of phrases because it's thrown around so casually.
Right.
And also I feel that as kids, we didn't know what right and wrong is. I mean, for us, what mama says is right, what she says is wrong is wrong.
Yeah.
So if she is coming back and saying she's feeling guilty, she's feeling too sad, then I feel like she's right to feel so.
Yeah.
And that's what I grew up with. That my mom did not give me attention, did not give me enough attention because she made me feel like she didn't give me enough attention.
Exactly.
So if I get 2 hours with her in the entire day, as a kid, if I'm saying if a kid gets 2 hours with her mom in the entire day, and the mom normalizes it, that that's how much you will get, and that's the best that I can do for you. Then the kid won't feel that it was never enough.
Exactly.
It's the feeling kind of bestowed into them from the parents.
Yeah, and it's also the external system that's telling you that you
feel guilty. Correct. So of course, I think acceptance would go a long way.
Because everybody they say like, oh, bacha hum paal lenge. I never seen kisi aur ka bacha somebody paalowing. Like nobody
does it. Of course, you have to take ownership of that, and then of course it's not going to be 100% how you imagined it. Yeah. So there's no thumb rule for parenting.
Yeah. There's no playbook in life in general.
Absolutely.
So do what you feel is right.
Correct. No, absolutely agree with that. So also, so another, I think we get this a lot from our consumers also for the brand. So that is that in a world where all victims, we all are victims of societal pressure to look good, and these media trends kind of dictate the ideal beauty standard. Do you think that our complexes and our insecurities shape the way we women think about ourselves? And how do you think that these complexes kind of shape our overall personality development?
Right. Yeah. So a very loaded question, right? I mean, a lot of the societal pressures is all advertisement. Right?
Correct.
However, it comes across. I mean, you'll see brands that will show that there are imperfections and it's okay to be imperfect.
Right.
And what is perfection even? Like who determines what is perfection? We look. I mean, there's the West that portrays that this skin color, eye color, this hair color. I mean, even within India, we have so much colorism that from the north to the south, it becomes an issue.
Right.
So it's, this is also, again, in families as well. Every family gathering, it is like, oh, have you gained weight? Have you lost weight? Have you, oh, ye badal liya, wo badal liya, bada glow kar rahe ho. Stop commenting on people's appearance.
Right.
It shuns down a person to such a small thing that is this it.
Yeah.
And then you're obviously internalizing it.
Of course.
We are our own biggest critiques. Hai na?
Correct.
No, we'll wake up and we'll see 10 imperfections on ourselves.
Absolutely. In fact, I think it's come to that point, what you're saying, that we look at ourselves with so many imperfections that women, especially women, they've become averse to kind of taking compliments also. Somebody would compliment me and say like, you look flawless. I was like, no, what are you saying? I would dismiss it saying that, oh no, I have such a big acne here. Do you not see this?
Right.
I mean, I would not full-heartedly accept that compliment. I would myself point out flaws. So, and this is very common. No woman wholeheartedly accepts compliments. They would in fact start counting their insecurities internally, even if they don't kind of say it vocally.
Right. So basically, like with this specific aspect, right, I believe in giving permissions to yourself. Give yourself the permission to accept the compliment. Sit with it. Like it's okay. Like just accept it. Learn to say thank you.
Yeah,
you know,
exactly.
Don't say thank you, but yeah,
absolutely.
Just remove that. Say with a thank you, and just be like, you know, how does it feel in my body? Like I am so uncomfortable. Like, why am I feeling uncomfortable about this? You know? And then go look at yourself in the mirror and give yourself the same compliment. Give it 2-3 times. You'll start believing it. You'll be like, yeah, it's not that bad. Like, yeah, of course, my hair looks great. Like, I am glowing today. Or just say this to yourself randomly. You know, look at yourself in the mirror and be like, yeah, you look great. I do that to myself sometimes, you know, especially like on a shitty day, I'm like, it's okay, you look great. And then you internalize it.
Of course. No, I think that's manifestation that helps. Of course, it helps. So, but I mean, you know, what I was talking about is that we in general, we have so many complexes and insecurities that we grow up with. So how do you think that kind of shapes up our overall personality, and these insecurities, shape up the way women think about themselves, they perceive themselves. So how do you think we can change that, and what should they be doing about it? Because, you know, kind of to not follow the ideal beauty standard, like I was saying.
See, it's very hard until unless you're a hermit to not be affected by the ideal beauty standard, right? I think somewhere down the line, you make a decision that how much of it can affect you, how much of it can you let go, how much of it is actually even true. It's a very good exercise to think about how much of this is evidence-based. You know, like this person is telling me this. First of all, who is he? Right? What does he know about me, or how I look, or what I've grown up with? And then you assess what you're comfortable with. I think that's, and to go on with that.
And how do we dismiss these complexes right at the beginning? So that it don't become such a big part of our life. How do we deal with complexes?
I think complexes, again, it's like
because I don't know any women around me who doesn't have some kind of complex. Either she's too thin or too fat or too dark or too many dark circles or acne spots. There is some complex. So how do we deal with that? Like,
I think it's about how you've been brought up, right?
Correct.
Like, and what influences surrounded your life.
Right.
For some people, like, it's, you know, that I see this in the South, that intelligence is so highly valued that it doesn't matter what you look like.
Of course.
Your brain is what matters. You know, how smart are you? And again, that can also go in a wrong direction, because everybody like, how smart are you? If I'm average, then I'm kuch nahi hu, matlab, you know? So it can go both ways. So it's about when you bring up a child, like it starts from there. You know, what are you feeding to them? Feeding, verbal feeding. You know?
Correct.
What are you constantly telling them? Are you constantly talking about their appearance? Are you constantly comparing them?
Right.
You know, like cousins. It's a big thing.
That's a big
thing. Ye badi sundar hai, ye badi lambi hai, ye badi iski naak lambi hai, iske kaan chote hai. Like, you know, the multiple things. Like, and
this, I think this comparison is what I think is the devil.
Exactly.
It starts there. Yes. Sharma ji ka beta.
Yeah. Fir kaun se Sharma ji? Kaun hai wo beta? I don't think I would see that guy. You know, because that's why I don't know.
Right. And you know, so this also happens on a very related angle only, that about self-esteem and self-worth that these women feel. And I think it's very often that it happens that it tends to be compromised and we don't even realize. Like, what could be some behavioral changes to cue to the women or to anybody that, okay, now you need to stop. Like, you're compromising your self-esteem. Like, you know, this is probably the filter where, you know, if you cross that, then it's not okay. That should be non-negotiable for you.
Right.
So, because I've, I had a conversation with a friend recently, and she's like, I think my parents overestimate my worth, because any guy that I take to them, they reject. And I'm just a normal girl. And I just felt like, why is she kind of demeaning her own self-worth?
Yeah.
Why is she undermining her own self?
Yeah.
Then
because sometimes the pressure is too much to be the best girl. Sometimes you're just like, I don't want to be. I just want to be a normal girl. Just, I want to like a normal guy. I want a normal guy to like a normal girl, and that's it. But parents obviously want her to be the Sharma ji ki beti, like you deserve the best, and that's okay for parents. I mean, that is our guide to be like, to get the best out of us. But that can also pressure us so much to be like that we have to, even in this aspect, have to perform and have to have the best guy. What is the definition of best?
And what about like, okay, so that is one part where you tend to, I think, of course, you succumb to the societal pressures of being like Sharma ji ki beti. But in even romantic relationships, we see this, that women tend to compromise their self-worth and kind of budge in arguments, because they feel that if it's not him, then who's going to love me?
Yeah, see, that's a very deep. That's a very deep question. It's very person to person based. Where this is coming from? Why is this coming from? That, I mean, for me to give a blanket statement I don't think it would justify your question. Because it would be very personal to each person.
Right.
That, I mean, I could say that, oh yeah, like you've been constantly told that you need to do better.
Right.
You need to like work harder. And you need to perform better, or 95 kyun aaye, 96 kyun nahi aaye,
so, exactly. So how do, I mean, I feel that the gap is like with most issues, like with most mental health concerns, like I was saying, that it's intangible. So how do they even come to recognize that, okay, now I think I'm on the borderline where I'm going to be compromising. After this, I'm going to be compromising my self-esteem, my self-respect, or my self-worth.
So I think that we draw personal boundaries. That, I mean, again, I am no one to judge where your self-esteem lies, with what, I mean, some people, are just not going to have high self-esteem, and everybody cannot have high self-esteem.
Okay.
So, for some people, that's their comfort zone. Maybe that's serving them. When anything in any issue, when it stops serving you, when it's becoming difficult to fake this persona,
right.
I think that's when you realize that, okay, now I'll have to change.
Okay, so that should be the cue for you to understand that, okay, now it's kind of coming to a triggering point for me.
It's not serving me. I'm uncomfortable with this. I'm saying this, but I'm not agreeing with. When you are not agreeing with what you're saying, I mean, again, this all comes to like awareness, I mean, to have awareness of your own thoughts and what you're putting out, and whatever you're putting out, is it like helping you? If it's not helping you, then you need to stop.
Right. No, I think that makes a lot of sense. Okay, so one other very important aspect is, of course, how the mental health is related to your skin health. And SEREKO as a brand stands for that. We're advocates for vocalizing mental health, and we're on a quest to, I mean, we're a very recently launched brand, but we're on a quest to reverse the impact of mental health concerns on the skin. Because, SEREKO, I believe that there is a gap which the consumers need to be educated about, that only using topical solutions will not help, because it could be something else. I mean, I discussed, I think I shared this story with you earlier about my cousin who was going through extreme anxiety issues that was manifesting itself on her skin, and a dermat actually referred her to a psychologist. And when she got her therapy sessions for her anxiety, her skin started improving. She did not need anything to topically apply, or any dermatological treatment for that matter. So have you had any patients that have, I mean, that complain of a skin concern emerging because, I mean, which you can kind of assess that it's because of this so-and-so mental health concern, which is probably also showing on their skin?
Yeah. So I had a client who was a caregiver. I mean, she was taking care of her father. Okay. And being a caregiver is very hard.
Of course.
If you have like your job and you're taking care of a parent who's going through their own problems, and you're on this continuous role. And she was developing psoriasis.
Oh.
I mean, and obviously everybody's like, autoimmune hai, wo cells kha rahe hain, like it's just like there's no solution to it. maybe you should cut down sugar, cut down alcohol, cut down any inflammatory thing, and just like live like a saint. And then she's like, I was doing all of this before, but then I didn't have psoriasis.
Yeah.
And I don't know why this is flaring, and it's flaring up like angry flare up,
Correct.
And it's because she was internalizing so much of being a caregiver, how much it was draining her.
Right.
That to keep giving with no help, nobody else to support you, and you're doing this all by yourself. And I mean, through therapy, it took her some time firstly accept that this could be psychological, because I mean, in normal, you're trying to do like a God's work to make sure that people know that that it's all connected. Forget skin and brain. People are like left brain, right brain. It doesn't work like that. It's one brain. It's one body. It's all going to affect the other. So for this very client as well, to slowly learn, to take care of herself, to fill her own cup, and then and to see the psoriasis, come down.
Right.
I mean, it's quite a. I mean, I didn't know about,
of course,
psycho
dermatology.
It's a big word,
Right.
and has a big meaning as well. So I mean, I was doing it unconsciously, but I was like, that for things that we're like, ye kyun ho raha hai? We don't know the reason. It's usually internalized.
Correct.
Mental
of course,
issues.
and then I think it becomes a vicious loop. You start internalizing and processing your emotional upheaval so much that it reflects on your skin, and that then you look at your skin. Your skin concerns become another concern, and that leads to more stress, and then that leads to more skin issues. So it just keeps going.
That's true.
So of course, I think seeking professional help, working on your internal feelings, would, as you mentioned, would of course.
I think for all of this, right, it has to be looked at holistically.
Holistically, correct.
Yeah. So I mean, say with with SEREKO, you look at you're doing one aspect. Now you're doing these podcasts to help another aspect, which is for them to directly work on mental health. And then maybe I don't know, exercising or small lifestyle changes. I mean, I don't like to bombard people with lifestyle changes. Also, kitna lifestyle change kar you have to live in this world.
Yeah.
So I mean, it's tough, and so to make small changes, to add small things that help you, to look at the picture as a whole, instead of just being
I mean, in isolation, no treatment would work. You have to have a holistic healing, an actual holistic healing, because that's what a lot of people don't understand. That in fact, for I think diseases for dermatological issues like psoriasis, eczema, and vitiligo, these tend to flare up because of mental health conditions, and doctors actually prescribe meditation and yoga and mindfulness as medication in their prescription, that you need to do this for this to kind of calm down.
Right.
So
even I had my dermat, right? So I'd gone to her, and I remember, she's a great person. So I was just chatting with her generally, and she's like, "यार मेरे को लगता है मैं psychologist बन जाती हूँ, क्योंकि half the time I'm just actually dealing with people's issues other than dermatology. It's not even about the skin. It's so much other. She's like, I don't know what to do. So
exactly. That's exactly what I think. That this is a vicious loop.
Yeah.
Because we're always stressing about our appearance, and that stress is causing more issues.
Yeah.
So of course we need them to break this. You need to be mindful in order to get good skin. So okay, so now I think it's been a wonderful session, and it was kind of amazing to have you do this podcast with us. So just one piece of advice for women who struggle with recognizing their mental health concerns or hesitate to proactively seek help.
One advice would be to find a therapist.
Right.
And I would say don't just immediately find the one and go to the one. Do your research, meet 2-3, make a good rapport, the one that fits with you best, and definitely seek help. There's no shame in it. The moment you do it, you will see the world around you change. You'll see the people around you change, and then they'll be like, "What have you been doing?" Because you want that too.
Of course.
Yeah.
No, I think that was an amazing note to end the podcast with. Thank you, Kirats, for being with us, and thank you everybody who's been viewing this. I'm always open to any feedback, questions, any suggestions for the coming episodes, and share it with someone who you think would need this. It's been an amazing podcast. Thank you
for
so
having
much.
me here. Thank you.